Now let's go into the second topic, which was the neutral host. Neutral host, we talked about it for quite a while. We started deployments about a year ago with T-Mobile. Now we have the addition of AT&T, but what is driving this, right? One question is, okay, this indoor coverage from public cellular is always a challenge, but isn't it getting solved? And the answer is it's getting even worse. The 5G technology is using like mid-frequency bands, like 3 gigahertz, 3.8 gigahertz, and so forth. The penetration characteristics are worse than the 3G and 4G. And the buildings are getting more and more energy efficient. So penetration becomes really hard for the buildings. So actually this problem is getting worse. And why do our customers care about it? They care because this wireless connectivity, even with the public cellular, is becoming mission critical for them. Many times they have folks on the shop floor, they may need to call a vendor for an issue, right? And if their phone doesn't work, if a salesperson is calling the customer and if the call drops, it's a big deal for them. Or you see cases where the customers are walking in. It may be a hospital, it may be a retail store, and the connectivity for the customer satisfaction is a big deal. And also E911 and emergency alerts, all of those things are also important for the end customer. So enterprises also care about the public cellular coverage in their premises. So we come to this as a complete solution, and the specific things we provided, right? Over the last year, what really happened? We now added AT&T, so now we have 2 operators as a generally available GA solution. And we started quite a bit of deployments across different verticals, and I'll show you some of that, like healthcare, retail, and so forth. And we are differentiating ourselves because our solution that you see here, the AP20, is the only solution in the market that can do both 4G and 5G simultaneously, right? So we have the capability of both 4G and 5G in our APs. And also our Mach-N Exchange, or our commercial solution, MOXN, is cloud-based, so it's very scalable and secure solution. So the solution is like future-proof with the 5G capabilities and scalable for our customers. And the last part I want to highlight is, in addition to the solution, we just streamline the whole workflow. Like from the time the customer shows interest to the time we bring up the service, in the DAS world, there's a lot of negotiations with the operators and so forth. We kind of streamline all of that. We take care of all the contractual interface with the operators. So the end customer, from the time they express the interest to the time we provide the service, it's very much streamlined. It's just a matter of a few weeks that we bring up the service. All right?
Question, congratulations on the AT&T, T-Mobile relationships. And hopefully there can be just a bit of a drill down how you're seeing progress, with how you're working with them and so forth.
Yeah, I mean, this is a new thing for them as well. Although T-Mobile has been doing it for quite a while, AT&T is maybe more ramping up with this workflow. Mm-hmm. But many things are quite streamlined now, right? There's a process, right? Once the customer shows interest, we send an application to operators, and they have an approval process. Most of the time, they approve, because if the customer is willing to pay, there's a real need for coverage. And after that approval, we do a process where we integrate the 2 networks, right? Our Mach-N connects to their core, and then they may need to do a few changes on the macro network base stations in the vicinity. So there are different groups involved in all of this stuff. But we have regular meetings with them. We look at the pipeline. We look at what's coming up in terms of service bring up. And so it's kind of not perfect yet, but I think we're in a really good place. My ideal goal is to kind of streamline it such that we minimize any manual intervention, right? Like ideally, it's fully automated. I think we all share that vision, but it will take us, honestly, a few months, maybe. There will be continuous improvements, but the ideal place may take us actually a year or 2.
Okay, that's helpful. Yeah, especially the automation, timeline, and I think that's shared across the ecosystem.
I hear you. I share it.
Good to hear that feedback.
Awesome.
I have a quick question. So I understand you're trying to extend the public cellular indoor. Do you find that your customers they try to do this very early as they're building the building, like at the architect level type of thing, or do you find that the customer they do this once the building is up and they find out that they have an issue and they're trying to solve it?
Yeah, I mean, great question. Honestly, we see a mixture. Okay. Sometimes there's a new building that's already in the works and they are used to thinking about DAS. And now they hear that, oh, there's an alternate solution. They want to see how we compare price-wise and performance-wise. So there are new buildings that are usually a potential opportunity for us. But honestly, those take like a year or two, right? The other set of customers are maybe those buildings had DAS, which was installed like 10, 12 years ago. Like there was a boost in the 2010-12 timeframe with the DAS deployments. Operators in those days were subsidizing DAS. Now all of those DAS are up for renewal because they're pretty old equipment. They cannot do 4G or even 5G for sure. So in that renewal process, then the customers start looking around, right? So that's the second bucket, renewal of DAS kind of bucket. The third bucket is maybe these buildings were never eligible for DAS. They are smaller buildings. They never had the budget. But now we have a very scalable solution. Even if it is 1 floor or 2 floors, they can go ahead and use our solution. And maybe they tried Wi-Fi calling, but the service wasn't maybe good enough for them. So that's the third bucket. So it's kind of a mixture.
Okay.
All right.
What frequency?
So all of this is still CBRS. So we are using the CBRS frequency, and that is making it very scalable, honestly, because then we don't have to work with every operator on the license frequencies and how exactly we integrate. If they're on a different channel than the license bands, I mean, the devices still roam to this band, CBRS band, but the interactions with the operators is kind of streamlined and simplified. And honestly, the cost of the AP is reduced because now we don't have to support like 6 different frequency bands and all of that stuff, right?
So you're really you're not offering a DAS because you're not in those frequencies. You're a Wi-Fi calling on CBRS.
Well, it is beyond calling, just to make sure I clarify that, right? When we go through this certification with the operators, I mean, it is essentially the same set of services, right? It is the voice, but it is voice over LTE or voice over NR, right? VoLTE service, E911 or wireless emergency alerts or wireless priority services and services to like first responders, right? FirstNet. So from the device perspective, when you walk in with, let's say, your AT&T phone, it shows like it's almost the same as an AT&T network. All the services you get from a macro base station, we provide the same set of services.
Does it say AT&T?
It does say like T-Mobile and AT&T, yeah. So from the icon perspective, it shows as like as a consumer, you wouldn't know the difference, basically. One of the hardest things is to demonstrate this because customer walks in, you just say, okay, it just worked. They're like, what happened? Well, now you have full bar. That's it, right? And also, if you are in an active call, right, in a voice call and connected state, you have seamless roaming between the macro network and this, because we are all connected back to the operator core network. Everything is anchored back at the operator core network. So that's part of all the services that I mentioned, right? I know we are already behind. So I already talked about our 4G, 5G capable AP20, and just wanted to give a quick highlight of the traction we see in the market. We see healthcare, retail, industrial customers, and higher education as our initial bulk of the deployments to date. And these are some of the public announcements we had with Stanford and Alcanca. But today we wanted to give you some more real data, field data. So Vanlin will go over some field data from the healthcare vertical. What drives the healthcare use cases are like the physicians, connectivity, their phones, patients' phones, connectivity, and it comes nicely together with private cellular. So this is one area where we see the neutral host and private 5G coming nicely together.
So I will continue from here. This we have deployed in healthcare in multiple locations, but today we are going to focus on specific building. So RF planning is very crucial because that ensures reliable connectivity. If you have a poor coverage, particularly in the healthcare scenario, it makes it hard for doctors and nurses to have reliable connectivity. So in this, what we are seeing here, we have like a 3-floor, and each floor is like 5 APs, and the third floor has 3. Total, we have 13 APs deployed. And the area, the floor 1, it covers is like approximately like 53,000 square feet, which is a larger area. But this 5 APs are good enough to cover the entire floor. So in this same hospital building, like they also have other alternative like Wi-Fi. Each room has one Wi-Fi. And we see like that there's a pretty like larger coverage you can achieve with the Celona APs here.
Do you know how many APs they had in that same space? Wi-Fi APs?
Customer didn't share that information,
Okay.
but what we noticed is each AP room has one AP there. Yeah.
I mean, typically the ratio is like 5x or
Yeah.
so, right?
And we also like to show the deployment location in the hospital areas where these APs were mounted in the ceilings. All these APs, like you see here, like it's omnidirectional, and it can operate on 40 megahertz bandwidth. It's like a high bandwidth. It can give you like more spectrum to have all kind of cool application, what Mehmet showed in the beginning, like patient phone, IPTV, patient monitoring system. So it needs a lot of capacity to have like a lot more data to go in. And also like this solution is a plug and play. It can easily connect to the existing routers and switch and existing firewall. And also if the customer have like existing policies in the NAC like ICE or ClearPass, we also integrate with those existing policies so that it will be easier for them to manage one framework. And also if they want to have a large scalable like MDM kind of thing, we can also integrate like with those. And in these facilities, you can easily configure those devices in large scale. And most of these healthcare facilities, what we noticed, it could be like a common users, right? Like a neutral host solution where the patients come in or the guest users come in with their iPhones, Pixel, Samsung, or Galaxy phones. So all those phones need to like work with the system, and also like doctors or nurses may have scanner to scan certain information about the patient. So we also have different device vendor work with like Zebra, and also dongles kind of system they use to connect the laptop to the system. Sometimes push to talk kind of application, Motorola Wave kind of devices have been using in this particular building. And coverage is very crucial, like because in those environments, the doctors make very critical applications like critical data transfer or critical patient case information. So I'm like to show here what does this building had before Celona Neutral Host versus after Celona Neutral Host. And if you see here, this is the floor 1. Like if you have a default connectivity, it's like a macro signal which is coming inside the building. So the macro towers can be anywhere outside the building, right? So this building has glasses, like Mehmet pointed out, like it's not like penetrating inside much. It's like more like a reflecting. And what you see here is the RSRP indication is the notation we use for cellular wall to represent the signal strength. In Wi-Fi, we call it as RSSI, right? But the difference here is you can go a little more longer RSRP values till it can able to decode. But having red regions of like minus beyond 115 to 140, that leads to a coverage hole. What that means is like, let's say if the doctors or patients or if the staff want to communicate, in this parts, maybe call won't go through. So either you may not receive the call or you cannot make a call. Sometimes it goes to a voice recorded mode. That's really critical for healthcare scenario, right? So we went and deployed our Celona Neutral Host solution. So this blue circle represents where our Celona AP20 were placed. And you can able to see the pretty good, strong footprint everywhere so that all this critical communication can happen more seamlessly and more reliably in this environment. So I'm also going to show a live demo where I walked in this particular building. So with a cart, trying to connect one device to a MNO network and other device to a Celona network. So quote unquote comparison, you see on the left side, it's connected to MNO network. The signal strength is not that good. You see like minus 112, 113, even 118 range. On the right side, you see it's connected to the Celona network. At the same time, you see the strong signal footprint. Not only that, you're moving from one AP to the other AP. There's a seamless roaming happens between inside the building so that this critical applications can run more reliably in this network. And we also try to show here, like sometimes these hospital buildings are 10 floors, 15 floors, right? Sometimes doctors travel, they need connectivity even in the lift area too. So we are trying to show how the coverage looks like inside this lift when you connect to Celona versus like MNO network. So you see here starts from 114, 15. When I'm inside the lift, it quickly dropped to 117, 19 is pretty bad. Versus you see on the Celona network, it's pretty strong signal even inside the lift. So this gives us more reliable connectivity everywhere inside the floor, across the floor, inside the lift. It's more crucial. So now, like what could be the alternate solution could be, right? So one we saw like using the existing macro network. The other could be like using Wi-Fi network. This customer already have a lot of Wi-Fi's deployed in 2.4 and 5. It's pretty densely deployed. One of the key things they keep mentioning to us, like when they have this Wi-Fi network, right? Critical messages, if doctor wants to use it, it won't come on time. Sometimes it gets delayed. Sometimes the message gets failed. Sometimes they have like more poor performance. And in emergency situation, if they want to make calls like E911, currently the existing network, what they have, it doesn't support. The other alternate thing they can look at it is like repeater DAS, like amplifying the MNO signal inside the building so that they can have good signal footprint. But unfortunately, it can give you good signal footprint, but still it's a repeater. You're just amplifying the signal. It's not going to give you a very high capacity. That was the challenge there. The other challenge there with the repeater DAS, lack of control and visibility, right? If the customer paying for it and he wants to know what's happening in his network in terms of how many sessions it happened, what is the download usage or upload usage, particularly if they're making a voice call, what is the success rate of the voice call, if there is any call failure, all this data, it's important for someone who is managing the network. So it is, unfortunately, there is lack of control and visibility in the DAS system. And we feel like Celona could be a right fit for robust connectivity, and it can also give more visibility to show like what is the usage of the network and voice call details, but much more minute granularity.
This could be the opportunity to
Sure.
ask the fundamental question. Can you characterize amongst all your deployments how many of the customers already had Wi-Fi implemented? They're
So they
best.
so this one is for healthcare, but we have like customers who deployed like in other scenarios, like for outdoor, particularly if I talk in terms of outdoor scenario. So it's really like if I say an example like oil and gas, like it's pretty large area. You cannot put a lot of Wi-Fi APs to cover,
Right.
because you need to build a lot of infrastructure, power, and cabling. And also building these poles, it takes a lot of money for them. It's a clear for them to see like some alternate solution like a long range coverage. But other scenarios like for indoor, for warehouse, right? So this like when you operate in Wi-Fi 5 GHz or 6 GHz, it's not penetrate that well. Like you have a lot of racks of wooden, or like it observes, it's not like penetrating large distance. And also you end up with putting a lot of Wi-Fi APs, and the mobility is the key point here, right? This bots, warehouses move around, and it makes a lot of challenging environment.
Yeah, and maybe if you're asking about the neutral host type of use cases,
Well, I'm
Or-
talking
or-
about virtually any environment. I guess, let me rephrase the question. Do you see customers asking you to co-manage with an existing Wi-Fi implementation, have overall visibility? Or are they kind of like parallel, networks?
Yeah, what we are seeing is it's really complementary. Okay, it's
Right.
benefiting both, honestly. So in this also neutral host use cases, as they may have Wi-Fi calling, because some customers have it enabled, some customers are not, because they may not like the fact that the IP address to the EPDG of the operator may be changing and so forth. So, but as they offload this traffic to the neutral host or private network, then it benefits the Wi-Fi network as well,
Yes.
right? Because then they can get better performance from the Wi-Fi side, and some applications and devices they offload to the private or neutral host network. So it's kind of a win-win situation when they have
Right.
both, and it's more frequency and all of that good stuff. Now, in terms of management of it, what we typically see is the customer, everybody has Wi-Fi, right? It's given.
Okay.
And for Wi-Fi, they typically have an installer and a managed service provider, and typically that same entity ends up taking ownership of the private 5G or neutral host solution for the customer. So it's one entity for the end customer that takes care of both networks.
Yeah, I can understand the competitive advantage here. I guess it's just adding the and. Of course,
It's an and.
we are, helping with making sure the Wi-Fi network is administered to the needs of the customer, in conjunction with the private 5G or neutral host.
Yeah, and,
Exactly.
and this slide specific to healthcare is that like the Wi-Fi isn't poor performing. A poorly installed Wi-Fi is poor performing, but you're proposing moving the applications like voice that lend itself to cellular
Right.
over to cellular. You're not
Exactly.
you're not suggesting that Wi-Fi in general is poor.
No.
No.
So Wi-Fi is good in most of the applications, right? Like you mentioned. But when it comes to like more like critical, like if you have densely deployed and if you are making, I have a couple of slides. It shows about the comparison between certain application, how the difference you see, like in terms of performance. So it is more good to offload such application to a reliable connections. So that's what we are trying to.
I think this slide is specific to the neutral host. And I think maybe because you guys have presented here so many times, like they kind of skip past a little bit, which is the neutral host is basically serving the carrier networks through your infrastructure, which is a whole separate use case from I want to deliver my own services through that infrastructure and take perhaps some of the stuff off of Wi-Fi that just needs better reliability and speed. So those things are not mutually inclusive or exclusive. You could use the infrastructure for one or both of those things.
I'll just add one other thing that, yes, most of the cases, probably 100% of the cases, it's complementary and it's an and, as you said. But we are starting to have some interesting discussions with some customers, particularly when it comes to warehouses of the future and even data centers. I think there's a sudden need to, as you all know, build more data centers. And as they're building new data centers and building new warehouses, they are looking at the devices that are actually being used. And if those devices actually have support for private 5G, they're like, do we really need two networks? So we are starting to get those questions who are thinking of warehouses of the future, data centers of the future, where they're actually deciding on which technology is better for them, and in which case it's an or decision.
All right. Good to know.
So this slide, I'm going to talk about a little more performance between the alternatives what we had, like which we talked about is the MNO network and the repeater, which is represented by RP, and the existing Wi-Fi network in the same building what customer had, and also the neutral host. So I'm going to show two different scenario. One is no load and with loaded scenario. So no load scenario where you have like only one user in the network and try to use the full advantage and see what is the maximum you can get, versus when you keep adding load into the network and how that is fairly allocating in the scenario. So on the left side, you see like the Wi-Fi and neutral host have maximum throughput, versus when you have MNO scenario, like this particular base station which is sitting outside the building, it is getting shared by other users in the building, and also the repeater which is amplifying the signal inside the building, and both this not having high capacity. Versus when you come into the loaded scenario, when you keep adding the number of devices, we notice that in CBR as in neutral host, like the allocation is more fairly shared among the users. Is mainly like due to deterministic QoS and max scheduling algorithm, versus what we notice in Wi-Fi when we keep adding the users in the network, because it has to content for the medium every time it wants to transmit. And we saw like it's not that equally shared among the users, but we see still better performance compared to the MNO and repeater DAS. The other important application is also the voice application. When it comes in healthcare scenario particularly, it is very critical. And in some emergency situation, doctors will call, or some patients, based on the case status from the doctor, they have to inform back to their family. So we took this application and tried to understand between 4 different technologies. So we have here static experiment and also mobility experiment. Static experiment we performed inside this conference room. When I say mobility, I was walking with the cart. You see here with the loaded devices moving around inside the building. And that's how the experiment in the static environment is set for the loaded environment. What we noticed, like for voice call in the baseline scenario, when people use the existing MNO signal, there are some spots where the coverage is pretty bad. The voice couldn't able to go through. Sometimes they're able to receive the call, but the quality of the voice is not good. And sometimes even it went to a recorded voice kind of system. But also the other way the operators can offload is through Wi-Fi calling. If the device have enabled the Wi-Fi calling feature, the call can go over through the Wi-Fi network. So now like we interested to see like what happens when it's loaded versus unloaded, how this Wi-Fi can able to still really guarantee the voice call, because that's going to be a realistic scenario when a lot of patients, a lot of doctors and a lot of nurses working back and forth, the medium will get more occupied. So we created that environment and tried to see in the mobility scenario how that behaves. So what we noticed when the user move around, the device tried to see like which is the best AP to move on. And we noticed the glitches and poor voice quality when the user started to move basically with the loaded carts and try to have some downloads, some uploads, and some streaming applications, which is more reliable to the healthcare environment. Versus we saw in the Celona Neutral Host, we loaded the same device and tried to lock to the same radio through PCIs. And we noticed that it can able to guarantee more good quality of voice throughout in the mobility scenario. So I will pause here and hand over to Mehmet to take from here.
Thank you, Vanlin. So maybe just to conclude this section, the other interesting learning for us was, like in the healthcare, we've been talking about private 5G for quite some time, right? We talked about patient monitoring and maybe clinical communications and so forth. And honestly, the ROI wasn't there, right? But once we brought the neutral host, the healthcare customers are now looking at this and say, okay, we can both solve my indoor cellular coverage issue so that my physicians, doctors, patients, visitors can have good cellular coverage. And on top of it, with the same infrastructure, now you can give me private 5G. Then suddenly the equation adds up, okay? So in this example, for example, okay, physicians' phones, patient phones, they are connected for voice and data, AT&T, T-Mobile, all great. But now the same infrastructure supports staff communications, some of the patient monitoring, and even some IPTV devices and so forth. So there's good synergy between the two solutions. And it also helps to the Wi-Fi network because now some of this traffic offloaded from Wi-Fi to this network. So that's how we see all of these things coming together, basically with the private plus neutral host. All right.